Hi, my name is Katrina Bird, but my patients call me Dr. Bird. Welcome to my channel. So today we're going to talk about how to prevent sexually transmitted diseases or sexually transmitted infections. So if you're interested, stay tuned. All right. So the number one way to prevent a sexually transmitted disease, STD, or sexually transmitted infections, STI, and STI is what we currently use in terms of referring to these infections, is to be abstinent, don't have sex at all. And then, no sex, you're not going to be at risk of these infections. However, if you're not about that life, continue to watch. So, okay, the next way you want to prevent sexually transmitted diseases is use protection, like use condoms. Like here's an example of a condom. The one thing you must do is make sure you have them on you if you're going to be sexually active. I wouldn't necessarily rely on my partner to have a condom. This is your body, and you really want to think like, how can I best protect myself? This is a decision you really shouldn't be thinking about other people. You really should be thinking, how can I protect myself? So make sure you have this on hand. When you have the condom, you want to kind of mash it, make sure you feel air in there. That tells you that no one has poked any holes or anything in the condom. You also want to look at the expiration date and make sure that it's not expired. So a lot of times people aren't aware of the expiration date and they may be using a faulty condom. You also can use dental dams. I don't have an example of that, but those are different ways you can protect yourself from sexually transmitted diseases. Please make sure you know how to use them. All right, so the next thing you want to do is ask your partner, have they ever tested positive for a sexually transmitted disease? So if they say yes, ask them which one, and then ask them if they've been treated. So it's really important that we normalize asking our sexual partners if they've been tested, if they have a positive test, if they were treated. Like, these should be normal conversations we should have before having sex. So the next thing you want to do is ask your partner when was the last time he or she was tested for STD. This is important because it's not going to help you if that person was tested 5 years ago and they've had multiple sex partners in between. So you really want to ask, when was the last time you were tested? Again, if you were positive, were you treated? All that jazz. So now you're thinking, okay, well, I haven't been tested in a while, or you know what, I think I should get tested. So where can you go? So there are a number of options. So you can go to your primary care doctor, your OB-GYN, Planned Parenthood, wonderful place. You could also go to your local community health center. And lastly, you can go to just a local STD clinic. So you're probably like, well, I don't really know about any of these places. I don't know where they are. So just Google, where can I get tested for STD near me? And you should be able to find some options. So additionally, if you either don't have insurance or you have limited funds, definitely check out your local community health center because they probably will be able to give you the best advice. Also, you want to check out the website of your local Department of Health because a lot of times they have resources of where you can get low cost STD testing and all the STD testing options near you. So definitely check that out. So let's say you get tested and it comes back positive. Number one, what should you do? And number two, should you tell your partner? So to answer the first part, you definitely should make sure you get treated. So majority of places, if they're able to test you for these things, they're also able to treat you. In my practice, for example, if someone comes in and I'm concerned for gonorrhea and chlamydia, after I give them the test, I'll also treat them too, empirically. So it's just a lot easier. Sometimes people are ashamed and they don't come back. They just want to know their results. And so in that case, you've already treated them. But you would have to have like a high index of suspicion to do that. And that doesn't work for everybody or every medical situation. the next thing you want to do is, should you tell your partner? That's the thing. And the answer is, you don't technically have to tell your partner, but you should. So let's say I test positive for chlamydia. The local Department of Health will call me because STDs, including chlamydia, is reportable to the Department of Health. So they will give me a call. Because I'm a responsible person, I will pick up the phone and confirm that yes, confirm my identity and confirm that I did test positive. The next thing they'll do is they'll ask me for my sex partners. So I will give them this information, and I encourage you to give them this information. Why? Because they will contact your sex partner and tell them that, hey, you've been exposed to chlamydia, you should get tested. If positive, you should get treated. What they won't do is they will not reveal your identity. So that's key, especially if you're like, I don't know if I want to tell my partner. You can allow the Department of Health to do that for you. They will not reveal. They're not going to be like, look, Julie, do you know that girl? Oh yeah, she tested positive for chlamydia and she probably gave it to you. So no, they're not going to do that. They're going to be very professional. They'll probably say something like, we were informed that one of your sex partners tested positive for chlamydia, so forth, so on. So in general, I think you should tell your partner, because at the end of the day, you should be building relationships on open, honest communication. And two, you never know if they knew they were positive, because people don't do right in these streets. So I've definitely seen situations where, a partner already tested positive and was treated and was just waiting on you to say something. Okay, so, it may be a situation like that. So you definitely want to make sure that you're at least, because you want to be in a good relationship, in an open, honest relationship. All right. So just to wrap it up, all sexually transmitted diseases are treatable. However, they're not all curable. So at the end of the day, definitely get treated if you're positive. But ultimately, we want to try to prevent these infections. And there should be no shame. I see this all the time. I see these things all the time. There should be no shame. Come in, get tested, get treated. That's my message for you. So let's review. So the number one way to prevent sexually transmitted diseases is to not have sex. However, if you're not about that life, the next best thing is to use protection in the form of condoms. Definitely ask your partner if they've ever tested positive for a sexually transmitted disease, when the last time they were tested. If you need to figure out where they should be tested or you should be tested, please check out, your primary care doctor, OB-GYN, Planned Parenthood, local community health center, and your local STD clinic. Overall, if you test positive, get treated. Don't not get treated. Get treated. This is all treatable diseases. And you technically don't have to tell your partner, but you should. All right. If you enjoyed this video, please click like and subscribe to my channel. All right, until next time. Bye.